So hello everyone. Today I'm going to talk about the monkeypox virus. Actually, the monkeypox it's a zoonotic disease. It spreads from animals to the humans, and this is a orthopox virus. Okay, so where we can see the virus most commonly, like its distribution. So it's most commonly found in the rainforest region of the Congo. So this is the Africa. This is the Congo. So most commonly we can see the distribution of the virus in the Congo region, and there are two strains of this virus are present. One is West African strain. So this is the West Africa, and another one is Central African strain. So this is a Central African strain. So you can see the two types of strains of this virus. So regarding this virus, it is a DNA double stranded DNA virus. So it's a very important. It's a double stranded DNA virus, like that of smallpox virus, and it belongs to orthopox virus, orthopox genus, and the Poxviridae family. So similar to smallpox. Okay, then what is the host of that virus? So most commonly the host of for that virus is rats, squirrels, and other non-human primates. Okay, then how this virus transmission to humans means there are two types of transmissions. Okay. One is from animals and second is from humans, infected humans. So from the animals like squirrels, rats, primates, through this direct contact of the feces, urines, and some and the debris. And the risk factors includes eating uncooked meat. So through this also humans can get infected. Then from humans to human, from the infected human, the through the close contact, okay, through the close contact, the patients get infection, like through using sharing the towels, sharing the bed, sharing clothes. Okay, then from mother to fetus, how means there will be two ways. One during the antepartum period and others during the postpartum. So in the antepartum, it can spread through the placenta. Okay, then in the postpartum period, there will be transmission of infection through the close contact of the mother or the baby. Then regarding clinical features, once the virus enters into the body, it will like some other viruses, it will have a period of incubation period of 5 to 21 days. So there are two periods divided into two periods. One is an invasion period, like prodrome period, like this flu-like symptoms are present. So all know what are the flu-like symptoms, like fever, headache, myalgia, back pain, fatigue, and lymphadenopathy. This lymphadenopathy is very important. Then regarding skin eruptions, most commonly the lesion first occurs in the oral mucosa. From that oral mucosa, it can spread centrifugally to other body parts. So there are several stages in the eruption of the skin lesions. So what are all these? Firstly, there will be small vesicles developed in the skin, and then it can converted into the thick pus-filled vesicles. So it's called pustules. And then third, there will be central umbilications, like central depressions present in the lesions. So this is called umbilicated pustules. Then these umbilicated pustules become ulcerated. So because there is a ulceration present in the skin lesions. So these ulcerated lesions then get converted into crustaceans. So see, there will be crustaceans present in the lesion. So crusted lesion, and finally it converted into scar. So there is scab. So these are the stages of the skin eruptions. Okay, then we can see what are the complications of that virus means. So the affected person will becomes highly immunocompromised, so he can get all possibility of getting infected. So immunity becomes so decreased. So the patient can get sepsis and the respiratory infections like bronchopneumonia and the secondary infections, and brain also get infected, results in encephalitis and corneal infections. So it will leads to blindness. So these are all the complications of the virus. Then how can we diagnose the case? So all we are know PCR, polymerase chain reaction. So the swab is taken from the skin lesions, most commonly skin lesions, and from the oral mucosa and other body fluids. Okay, by this we can diagnose that virus. But there are also some different diagnoses are also present for this virus. The lesions are quite similar to some diseases. So what are all they means? They are chickenpox, measles, bacterial infection, scabies, syphilis, medical allergy sometimes. So the lesions are also quite similar to the monkeypox. Then lymphadenopathy present in the monkeypox virus. This is very important because how we can differentiate monkeypox from smallpox or chickenpox, because in all these lesions there will be no lymphadenopathy, but in monkeypox there will be lymphadenopathy present in the body. So by this we can differentiate the disease. So treatment. So what are the treatment options? There will be no specific treatment for that monkeypox virus. Only there will be symptomatic treatment. Symptomatic treatment only available. Like we have to first treat the fever, body pain, myalgia, headache. Like this only we have to treat, and we have to manage the complications. These affected patients are very sick and they are deprived of fluid in the body, so we have to maintain fluids and electrolytes in the body. And another thing, tecovirimat. This is most very important, and it is a antiviral agent. It's most oxygen PG. So this is very important. Tecovirimat, antiviral agent used. And how next step is we have to use vaccines to prevent infections from the community. So what are the vaccines? So most commonly we are using smallpox vaccines, because the antibodies produced against the smallpox vaccines has cross-react with the monkeypox. So on those days, but now the smallpox is totally eradicated, so these vaccines are not most useful. Then another one thing is modified attenuated vaccinia strains, Ankara strain. So these vaccines are used to treat the monkeypox virus. So in general, how can we prevent the infection? Means we have to maintain distance from the infected person. We have to wash our hands, clothes. We have to maintain a personal hygiene, and we have to isolate the patients, and we have to quarantine the patients and to treat the patients symptomatically to prevent the disease in the community. Okay, thank you.